flesh-eating maggots, lab-mutated flies, and the uncertainty of our livestock production is public health. I'm Maria Andrea, the Community Engagement Specialist from Williamson County and City's Health District, a county just north of Austin, Texas, who's a passionate public health worker with almost a decade of public health experience dedicated to making public health more accessible to you, the public, on Public Health Is. If you've ever been curious about the ins and outs of public health, join me for a special series I'm calling Public Health Is in the News to learn more about emerging public health threats, how they could and would impact the Lone Star State, and what that means for you as a resident of Williamson County. Today, we've got a special guest if you'd like to introduce yourself.
Hey there. So my name's Jason Fritz. I am the public health entomologist here at Williamson County and City's Health District. And what that means in English is that I work with bugs and their diseases that impact public health. So overseeing our mosquito surveillance and control program is my baby here at the health district per se. But I also work closely with our disease detectives that you've heard about recently, investigating human cases of vector-borne diseases. So things that previously were mentioned would be like typhus or malaria, West Nile virus, and any other emerging threats.
Right. And so when you say vector, like for you specifically, it just means diseases spread by bugs. Bugs are the vector.
Most of the time, yes.
Okay. And so Jason's here today because we've got a very particular bug of interest here in Texas. You could speak a little more on it, Jason.
Yeah, so aside from our normal friends that we see here in Texas in our summer months, the emerging pest of concern is New World Screwworm. If you've been watching the news or on any kind of social, you've probably heard about it at some capacity, but it's not a worm. It is actually a maggot from the New World Screwworm fly. So what she does is this fly kind of breaks the mold of our other fly species. Most of the time flies are associated with dead things or, something decaying and whatever. They're actually beneficial. They decompose stuff. So that's good for the environment overall. But this one, her role is to get into an open wound and lay her eggs, and those larvae or maggots will actually feed on living tissue. So just as gross as it sounds.
So lovely. And you're saying her because it is specifically the females that do this.
That is correct. It is those ladies.
Man, those ladies are vicious.
They are. And, that name for the fly, her scientific name is Cochleomya hominivorax, and hominivorax actually means man-eater. So we know historically this fly has affected humans. There have been some cases of infestation in people, but I think it's really important to know that this is predominantly an animal health threat.
Right. And so you said animal health threat, but how does that tie to us?
Yeah. So this is an area that I'm really passionate about is One Health. And I don't know if you've talked about it on the series yet, but One Health is that understanding that human health, animal health, and environmental health are all interconnected. And when something's wrong on one side, it can have adverse effects on the other. So this is a classic scenario with that, where we have an insect that can infest animals, but also people. And if left unchecked in either an animal or a human, it can be fatal. But from the animal side, that's really important for us. Here in Texas, we love cattle, and that's what's mostly affected by this epidemic right now. But if we have issues with that commodity, then we could see significant economic impacts, predominantly in livestock, with those producers and ranchers that move that operation. Think of it like, a few years ago when we had the issue with bird flu and eggs were $7 a dozen in the grocery store. Those costs out in the production side are often pushed to us as the consumer. It's also kind of scary that we here in Texas and our Gulf states have the perfect climate for these bugs and all of the other bugs that swarm us throughout the summer months. But it's that changing climate health over the years, which is a whole other subject, right? That really play a role in the ecology of these bugs overall.
Okay. So I have questions. What is our risk to people? What is the risk to other animals like pets? And then you already mentioned livestock.
Yes, the risk I would want to say for humans is low. If you have a wound and you're spending a lot of time outdoors, the risk isn't absent, but most of us have pretty decent living conditions where we're bathing every day or we're able to clean up a wound where it's not something susceptible to a fly laying eggs and after a few days, this nasty wound occurring. So that's what we're following closely here at WCCHD. But with our pets, again, overall pretty low risk. I know my pets at home are very well pampered and spend all of their time indoors. They would not last outside here in Texas. But if they're on some ectoparasite, or things like fleas and tick preventatives, then, that's going to improve their protection from this parasite.
Okay. So that's good to know. So realistically, even if we're thinking about like people and non livestock animal cases, it would be more so ranchers
I
that
think,
would be higher risk, and then maybe the livestock guardian pets they've got.
yeah, I think folks that have livestock, whether that be cattle, sheep, goats, pigs, and even some of those accompanying what we would call like a guardian animal, like if you've got a sheepdog
Mm-hmm.
or a llama or a
Mm-hmm.
donkey, something like that, that protects that herd, typically in your sheep and goats, because they're vulnerable to predators. But those folks should really be the most vigilant right now. And then overarching, we can also see these things as you're driving down the road. You look in the field and there's cattle there. It's not always obvious that an animal might be infested, but the people that own those animals need to really be keeping a close eye on them. Your eyes are your most important tool early on in something like this.
Okay. And so then focusing on livestock, is there a risk to us with our food supply?
There's not. A lot of times we may associate flies around food and that mechanical risk of fly landing in manure and then going and landing on your hamburger. This fly acts completely different. This fly doesn't prefer things that are dead. She wants something that is alive, that is a warm blooded host to lay her eggs. So, those animals that are used for food, when they go through their process through the slaughterhouse and things like that for that farm to table
Mm-hmm.
approach, there isn't anything new in terms of regulations that this is throwing a wrench in, other than, the movement of animals to that next step wherever
Mm-hmm.
they're going on their journey.
Right. And if something were just super infested, it would not enter the food supply at all.
Correct. And another consideration is when these animals are being treated, because this is a treatable condition in people and animals. But depending on the medications that these animals receive, and that's for general animal illnesses that happen every day that we don't think about, there are things called withdrawal periods where if they're given a medication, there's a certain period of time before they can even enter into the food system. So that's something that's important to note, that an animal with a screwworm infestation isn't immediately disqualified from going to the table necessarily, but when that animal is infested, it is likely not going to be sent to that building.
Mm-hmm. And so while you mentioned we would focus primarily on people cases, if someone were to see something or they've got more concerns, questions, who could they reach out to?
Yeah, the biggest thing right now is we're in that very strong vigilance phase. It's in southern Texas, making its way further in. Every day we're hearing about cases, but it's really that if you see something, making sure we can get you to the right person. Again, here at Williamson County and Cities Health District, we would be a contact if there's suspicion around a human that might have this. In humans, if they have a wound that's not healing or they see something moving in a wound, without getting too creepy on this, but there's some visuals that can accompany that, that's where you would call us. But if you have one of your cattle is acting funny out in the field when you're doing these usual inspections, taking out feed to them or what have you, getting your eyes on there. If you notice something like that with your livestock, the Texas Animal Health Commission is the kind of state veterinary authority that
Okay.
you would report that to, along with your regular veterinarian as well.
And what would that number be?
Yeah. So for Texas Animal Health Commission, that number is 1-800-550-8242. And that's a 24/7 line to report suspicion of New World Screwworm. So you don't have to be a veterinarian to call them. You can just be an owner of an animal. They would like you to go through if you have a veterinarian established, let them know as well so they can come treat that animal and get that started, and also kind of help facilitate the testing and things like that that come with a potential detection.
And again, that number is 1-800-550-8242 for the Texas Animal Health Commission to report any cases.
So I think the last thing that we didn't talk about is wildlife. A lot of us may be in a neighborhood that has deer and things like that. So again, if you see something, the person to call for wildlife, something that is not a domestic animal. I know some deer in some neighborhoods are quite domestic,
In
but
my neighborhood,
they
walk up to you.
You can walk up and feed them and really get a good look. But if you have a wild animal that you think isn't acting right, Texas Parks and Wildlife is going to be the folks to call. Their number is 512-389 4505.
So that is great information, but actively within the state of Texas, what is being done to try to mitigate that risk?
Yeah, since the detection, as of this episode, there have been 12 detections in animals. We haven't had any human cases associated with this outbreak, if you will.
Mm.
But Texas Animal Health Commission is working alongside the U.S. Department of Agriculture. The primary response is going to be defining those zones where these infestations are occurring and increasing inspections and things like that. And quarantine is a word that's used, but not thinking of a lockdown. It's more of a let's make sure that these animals are inspected by appropriate authorities before we move them, so we don't move the larvae of this fly to other places where it can infest other folks' operations. But on the bug side, the control measure is what's called sterile insect technique. That's something that has been very well studied. It is what eradicated this pest back in the 60s, and it has worked in little tiny reintroductions in the 70s and then again in 2016. It's quite effective, and what that is we take, I say we, I don't do it, but what the feds do is they're able to grow these flies in perfect settings to make sure everything works right and we get the most bang for our buck, if you will. But they feed them on an artificial diet. They're not feeding these flies on lab animals. It's an artificial diet that is nutritious to them. And then in the pupal stage, so think of it like a butterfly, but just a little bit more nasty. We've got eggs, you have larvae. The larvae become a pupa, which is like when a butterfly is in a chrysalis or a cocoon, that resting stage. And then the adult comes out, which is something pretty. And the adult fly herself, I mean, she's a shiny blue, pretty to someone's eyes, maybe.
Exactly. I would argue all flies are ugly.
Right. Yeah. She's not my jam, but I do have a lot of mosquitoes that I adore their looks, not their life choices. That's the fun part of being an entomologist, right? But what they do in that pupal stage is they will expose them to gamma radiation. So basically put them in an X-ray machine. And what that does is it renders those pupa sterile. And when those pupa emerge, it's a 50-50 ratio of male and female. So if we've got, in small numbers, 100 pupa, you're going to get 50 males, 50 females. But think of this on the scale of millions of pupa that we're doing this. Once those flies are in that pupal stage, they can be shipped to these infested zones. And then there are different methods at which they're released. But the grand scheme of it is once these sterile flies are released, those males, sterilized males, will mate with wild female flies. The important thing is that female fly, whether she's sterilized or not, only mates once. The males, they are promiscuous. They will mate with as many females as they can. That's really their main point in life. But when that sterilized male mates with a wild female fly, that female cannot produce viable offspring. So she may lay eggs in a wound, but those eggs will never hatch, thus reducing the fly population over time. So it's not a silver bullet, but it is something that when you pair that using that integrated pest management approach, using a multitude of things such as the surveillance and the quarantines and things like that to treat those animals over time, lowering hopefully to zero that wildfly population.
And is there any risk to general human population? Because I know when we talk about radiation, there's always that concern that it could leak to the people around.
Right. So there isn't a radioactive risk of these flies. It's just like if you or I were to go get an x-ray of a suspect broken arm or something, there is that brief exposure of radiation, but this isn't like Chernobyl flies or anything. From an ecosystem standpoint, we don't want this fly. She does not decompose things that are dead. She decomposes you alive. This is what the USDA calls a foreign animal pest. So she is not allowed here in the United States, and we're trying to get her back out of here.
And just, general idea, how long do the males live?
So general life cycle of that fly is about 3-ish weeks, give or take, based on environmental conditions.
Right. Because I'm just thinking, let's say I live on some land next to a ranch that has known cases, and now I'm seeing all these flies, panicking that there'll be a risk to me or to others, but there's not really anything.
Right. There's no risk. And that's something that, because we know that sterile insect technique is so effective, that is something that you would hope to see. And honestly, even during a sterile insect release for these flies, you're probably not going to see them.
Okay, that's good to know.
You may see clustering of other fly species, but it is likely not that New World screwworm fly. They are seeking out a wound. They're not seeking at you the way a mosquito would for just being outside and breathing. So your likelihood of seeing an adult fly in general, whether it's an infested zone with or without the sterile insects, you're probably not going to see an adult fly. It's those maggots or larvae that we're most looking for to determine the presence of New World screwworm.
Awesome. And so, Jason, to close out, what would you say is the take-home message when it comes to New World screwworm?
Yeah, so really just my top 3 that I would say is, again, focusing that food supply is safe. This is a parasite that affects living animals. So meat and dairy products are not a concern. And like we said earlier, these affected animals are likely not going to enter the food supply system. The other thing is if you don't have a veterinarian and you have animals, this is your sign to get one. They're the frontline public health workers in a response like this and play a critical role in public health. They could also advise on prevention and treatment of these animals. Again, this is a treatable thing. If you are suspicious of screwworm and don't have a veterinarian, use that Texas Animal Health Commission number that we gave earlier. And then lastly, reporting is super important. Whether if you don't get it to the right person, we will find the right person. But the quicker we can detect New World screwworm, the quicker that resources can be directed to eradicate this pest, whether that's in a livestock animal, a pet, wildlife, or even a person. So I think that reporting piece is what is really going to help us with resources.
Absolutely. And then just a reminder that our main focus is to be in communication with our partners. If there were to be a human case, then obviously we would be involved in the action. But other than that, we're in the same boat as y'all, just watching and talking and making sure that everybody has the information and resources needed to address this.
Absolutely.
Well, thank you so much, Jason. Appreciate it. I think you already shouted them out, but thank you so much to our local veterinarians, state veterinarians, the Animal Health Commission as well.
Yes, and our ag extension agents. Here in Williamson County, we do have ag extension agents that are often a first line phone call for whether it be an animal issue or a plant issue, things like that. And they are going to be fantastic in making sure that concern gets routed to the appropriate authority.
Awesome. And a big thank you to you if you've made it to the end of this episode. If you enjoyed what you heard, please follow this podcast, comment, and share this episode with family and friends. Want to learn more about emerging public health issues and all the great work Williamson County and City's Health District does to manage them? Tune in on the 2nd and 4th Tuesday of every month for new minisodes where we'll discuss WCCHD's roles in keeping our communities healthy and safe. Be sure to check out our website at WCCHD.org and follow us on all our social media pages for more information and podcast updates. Are you interested in learning more about a specific public health topic for a future episode? Feel free to reach out to us at publichealthistx@wilcotx.gov. And remember, public health is you, it's me, it's we, it's us. It's the New World screwworm.